Good morning, respected judges. I shall be presenting on the comparison of vessel density values using OCT angiography and RNFL in POAG and glaucoma suspect patients. The ONH vasculature dysfunction is believed to be a contributing factor in the development of glaucoma. Thus, what we need is a reliable, reproducible clinical method for early detection and monitoring. OCT angiography is a new method for analysis based on high-resolution, non-invasive technique, whereby retinal, choroidal, and optic nerve head circulation can be visualized without the need of dye. Our aim was to evaluate association between vessel density measurement using OCT angio and RNFL analysis in POAG and glaucoma suspect. It was a cross-sectional observational study, and data was collected from diagnosed cases of POAG and glaucoma suspects attending the glaucoma clinic and healthy eyes fulfilling the criteria. Our sample size was 120, 40 each in the 3 groups. Inclusion criteria was more than 18 years old, open idocorneal angle, and BCVA of minimum 0.48 logMAR units. Exclusion, no history of intraocular surgery except glaucoma and cataract. Secondary causes of glaucoma were excluded. Non-glaucomatous optic neuropathies, vascular and non-vascular retinopathies, and other ocular systemic diseases were excluded. After taking proper consent, a detailed history was taken and examination was done in the following way. UCVA, BCVA followed by anterior segment, IOP with GAD and CCT measurement, gonioscopy, HFA, fundus examination, then OCT, RNFL and ONH, and ONH angiography using Cirrus HD OCT 5000. This is one of our glaucoma suspect patients with IOP26 CDR ratio 0.6 with with normal visual field test. The first one is showing the inherent perfusion density in percentage and flux index. The B diagram is showing RNFL thickness in microns in the 4 quadrants. And this is the pictorial representation of the vessel density, which was converted to fractal dimension image by box counting method and by using the MATLAB software. Our results, we compared the 2 parameters, found an increasing trend from POAG to healthy, and the ANOVA test showed a significant ratio in both. And we compared pairwise post-hoc tests for bonfirinis and found it significant in POAG versus healthy and suspect versus healthy. For diagnostic accuracy, we ran a ROC curve, that is the receiver's operating curve, between POAG and healthy, glaucoma suspect and healthy, and POAG glaucoma suspect. The red line here signifies vessel density, while the blue line is OCT RNFL. In the first curve, we can see that both vessel density and RNFL are performing similarly, while in glaucoma suspect and healthy, we can see that the vessel density is outperforming RNFL. In POAG and glaucoma suspect, RNFL is doing a much better job. We compared our study with Yar Muhammad Ali et al., whose findings were quite similar to ours. And Triolo said that RNFL is better diagnostical ability and put forward the hypothesis that neurodegeneration is more prominent than microvascular degeneration. In conclusion, RNFL has better diagnostic capability in differentiating glaucoma from healthy eyes. However, OCT angiography was found to be better in screening out glaucoma suspects from healthy. Thank you.
Just go back and show the AIOC. Can you just show that slide again? Don't switch off. Yeah, thank you.
We took 0.750 as the base.
No, just one thing. Your AUROC for POAG versus healthy, OCTA VD is 0.86. And glaucoma suspects versus healthy is 0.918. It's little unusual. The definite glaucoma should have a better AUROC compared to the glaucoma suspect. Usually by tradition, because definite glaucoma is more RNFL loss, more structural changes as opposed to the suspect.
Yes,
so can you just?
So that is what was our confusion, because when we compared it with other, this was like Yar Muhammad Ali's comparison, they found both of them to be significant.
I'm not talking about that.
Yeah,
I understand. First of all, significant 0.9 is decent enough.
Yes,
but
sir.
I'm saying that the POAG AUROC curve is little inferior compared to glaucoma suspect versus
So
healthy.
our conclusion in this
No,
was.
I'm not talking about conclusion. Now I'm showing you the data.
Yes, sir.
I'm asking you a question related to the data. So I'm not bothered about conclusion. Every person can conclude what they feel appropriate based on the data. The question you have to answer now is that why this discrepancy?
So
Either
in,
there is any scientific logic or is just the data variation.
so in POAG versus healthy, VD and RNFL is almost performing the same way. But in glaucoma suspect and healthy, the vessel density is showing quite a, this one. For maybe neurodegeneration is a later stage of microvascular.
No problem. Thanks. And second, when your study design is POAG and glaucoma suspect, your inclusion criteria should not be the standard like 18 years. So we should be 40 years plus to start with. Okay. There is no point having 18 year plus because POAG by definition is 40 year plus because otherwise you will diagnose as juvenile open angle glaucoma. Okay.
Yes.
And for control also, it should be age matched. So there is no point taking controls who are younger, and if you're not age matched, then there is a flaw in study design.
Yes.